Hello everyone, I'm Leslie Cornwell, certified nurse midwife with Empowering Midwifery Education. This section has to do with physiological changes during pregnancy. A legal disclaimer we put at the beginning of all of our presentations. This information is for general and educational use only. Content is not intended to substitute for professional, clinical, or legal advice. We strive to keep our information as accurate and timely as possible, but make no promises and guarantees it works for your local unique situation. Course objectives, the students will be able to verbalize what exactly are the different components of when someone gets pregnant, the physiological changes that occur. They'll be able to verbalize the signs and symptoms of what's normal and what's not normal, and especially the different ages, gestational ages throughout the pregnancy. There's different changes that occur. So there's physiological changes that are very classic and consistent in the first trimester, in the second trimester, and the third trimester. They'll be able to verbalize how you can diagnose pregnancy by these physiological changes. Not having a period, breast tenderness, Chadwick sign, the bluish cervix, like the list goes on and on. The nausea, the vomiting, the needing to eat all the time because the blood sugar gets low. There's a lot of estrogen, progesterone, and hormones that are going through their body that can really impact how they're feeling. The blood flow increases greatly, the feet size change, their hips change, their breast enlarge, and the milk starts coming in. I mean, there's just so many crazy hormones that happen during pregnancy. So you'll be able to talk to women as a midwife, a healthcare practitioner, how to support them through the pregnancy changes and what's normal, what's not normal, what can we help to decrease those symptoms with comfort measures, exercise, nutrition, decreasing stress, modifying activity, eating better, drinking more. There's so many things we can talk about that they can change or they can't change just depending on what it is. So this topic is really important because pregnancy is this amazing process that happens to a woman's body. When she has a baby, she becomes pregnant in her body, that she can make immense amount of changes happen in a short amount of time. You are now growing another being. The cells are growing astronomically. The body is preparing to grow the baby, to feed the baby, to support the baby, to birth the baby, to nurse the baby after it comes. Like there's just the placenta is grown just for the baby, and then as soon as the baby delivers, it is no longer utilized. Like the power of what a woman's body has as soon as they get pregnant until postpartum is just absolutely phenomenal, what evolution has designed with this process. There's many systems that are impacted. Their muscles, their hormones, the reproductive system. They're no longer going to get pregnant again because they're already pregnant. There's increased discharge. There's increased blood flow. There's just so many changes happening. The ligaments, the muscles, the loosey-goosey feeling, that pregnancy waddle, the blood flow, it increases, and there's just so many extra demands on the body. The respiratory system completely changes with the relaxin and the space that the baby creates, especially towards the end of pregnancy, the shortness of breath and getting lightheaded easily and just not being able to take good, strong, deep breaths because there's just not as much room in from the hormones. The gastrointestinal system, so just constipation, diarrhea, the changes that occur, the kidneys and the filtration system, the productions that occur are just absolutely amazing. These symptoms can be so different to so many different people. And so we talk about the hormonal changes in the different parts of pregnancy, and each one is unique. Some can be gradual, some people have some people have none. It depends on the hormones of the baby, the estrogen, the progesterone, your body, your age, what you eat, the stress in your life, your culture. There's so many variables that affect it, and it's not just about the mood, it's just the actual physiological changes, the relaxin, the hormones make everything completely change in a woman's body when she becomes pregnant. The reproductive system, the uterus, the cervix, the uterus just amazingly grows and expands and then shrinks down quickly after the baby comes. The cervix enlarges, increases mucousy discharge. It opens and thins when it's time for labor, and then it shrinks right back down after the baby has delivered. The vagina completely changes with the extra blood flow, the shape, the expansion during all the labor and the birth hormones. hormones and allowing to open for the baby's head to come out and then immediately shrinks back down. It's just absolutely impressive, the changes that happen in a woman's body, musculoskeletally, her posture, her stamina, her shape. She falls easily, the gravity. She really just has a lot more things to be careful of, the equilibrium. The baby is putting so much weight and leaning her forward that she has to compensate with the rest of her body as the pregnancy goes on. The articular changes, so the relaxin hormones, the estrogen, the progesterone, particularly the estrogen, progesterone at the beginning with the hips and the cramping and the stretching, and then towards the end of the pregnancy, the relaxin and those hormones peak up again to prep for the actual birth process. Water retention, particularly in the summertime, and increased salts and dehydration. She'll have some swelling, and sometimes it can be serious. It could be preeclampsia versus just normal physiological changes. There's certain joints that get particularly tender and reshape and shift, especially the pelvic bones. The ligaments, they just become so laxed for quite a while after the baby comes, and so it's really important. I wish more and more midwives would recommend physical therapy, pelvic floor support after birth. Musculoskeletal changes, with the uterus enlarging and the abdominal muscles having to support all that, you get extra girdle stability. Some people have to use an abdominal support binder. The curve of their spine really gets exaggerated, especially if she has a chronic history of back issues and problems and pinched nerves. Seeing a chiropractor, exercise, good proper body mechanics, eating well, not excessive weight gain during pregnancy will help a lot of these discomforts that happen during pregnancy. Cardiovascular changes, there's a drastic increase of cardiac output, 30 to 50% above the normal baseline, particularly in the third trimester. It's meant to compensate with that blood loss and the circulatory process. So if you have a woman that has a history of cardiac disease, it's really important to kind of learn more about it, what stressors will affect it, what won't. Some women get heart arrhythmias, some women get palpitations, shortness of breath easily, their heart will race. There's just so many things that can happen. And our job is to check their blood pressures, listen to the heart and lungs, follow up on symptoms and questions and concerns they have, get a cardiologist and a specialist involved if you need to, but most of the time it's just normal changes, and then she'll go back to her baseline after the baby comes. Respiratory changes are absolutely amazing. The tidal flow, the accommodation, the expansion, there's just not as much room for her diaphragm and her lungs towards the end of pregnancy, and just the actual expansion demands that are made by her lungs and her changes in her breathing pattern. The lung volume changes pretty drastically. The residual capacity decreases by 10 to 25%. The expiratory reserve volume increases or decreases by 15-20%. The residual volume decreases by 20-25%. The overall lung capacity decreases. She has an increased respiratory capacity overall of 5 to 10%. The rate will typically be a little bit faster. The increased tidal volume, 30 to 50%. So depending on what stages of the pregnancy, particularly towards the end, you'll see the most of the respiratory changes coming into place. But a lot of women, like even in the first and second trimester, they're going to be short of breath easily. They're going to feel going up a flight of stairs feels like they just went up five flights of stairs. They're going to have a slower pace. They're going to just get short of breath a lot easier than normal just because of the hormones, no matter if they're an exerciser and have endurance or not. Gastrointestinal changes, it's very common in the first trimester because of all the increased hormones and changes with the baby growing to have morning symptoms and nausea and vomiting. You can get more extreme situations of the hyperemesis that can cause serious complications throughout the rest of pregnancy, but most people start feeling pretty good by 14 to 16 weeks. The peaks of those hormones that make people really nauseous are around 9 to 10 weeks, and then it starts settling off. We're not really sure. Nausea could be genetic, it could be the hormones, it could be the low blood sugar, it could be so many different things that are happening. A lot of women, especially towards the end of the pregnancy, get constipation and hemorrhoids from the pressure and the not drinking well, limited mobility, the intestinal system being squished by the baby. There's just a lot of factors happening. So you definitely want to just assess and see, is this normal? What comfort measures you can do, especially in the first trimester for morning sickness. You can small, simple meals, the bland diet, the brat diet, the ginger, the teas, the staying away from smells and spices, and walking after eating versus eating right before bed. There's some simple things you can do to help with the digestive changes that occur with women. The renal changes, so the kidney function, there's a lot of tests they can do, especially towards the end of the pregnancy with the kidneys if they're worried about preeclampsia and blood pressure issues. The water retention is common during pregnancy, so you want to eat well, limited salts, limited processed foods, drinking lots of water to keep your kidneys working well. These are key common signs and symptoms of pregnancy, but you just didn't get a period. You're due, you're late, you took a pregnancy test and the HCG hormones were present and now you are confirmed pregnant. The breasts can get enlarged, they can get tender. Some women start leaking before the baby is delivered. Usually that's a minimum 17, 18 weeks. We've seen that happen. Nausea with some vomiting, the mood swings, the pelvic achiness, they just feel off is a very common symptom. During an exam by a midwife, the uterus can be enlarged, you could get a heartbeat, the cervix can be softer, you can have the Chadwick sign with the bluer tint from the increased blood flow. You can do a pelvic ultrasound, you can do a bimanual examination. There's a lot of things you can do. You could take a urine pregnancy test, you could do a blood test. There's just so many things out there to confirm. The official diagnosis is based on ultrasound, fetal heart rate, beta HCG being noted on a urine or a blood test. You could do quantitative measures versus qualitative. Quantitative is the actual number for the HCG versus qualitative just tells you yes or no it's present. HCG is not present when out being pregnant in women. If you get a positive pregnancy test and you're a man, you start worrying about prostate cancer. So HCG is a very classic hormone that's tested in those urine pregnancy tests to determine if someone's pregnant or not. Heartbeat, the fetal heart tones with the monitor, there's very key things you can do to officially diagnose it. There's certain things you kind of want to watch for that are changes to give them a heads up, watching out for preterm labor, watching out for changes and issues and problems that can occur, that you want to make sure that the mom is staying nice and healthy during the pregnancy. So you want to really talk to her about all the muscles and the hip and the changes that occur in her body so that she can really tell you, yep, this is normal. This is normal vaginal spotting with wiping and just had sex and constipation, or this is period-like bleeding and we're worried about the placenta and we should further evaluate. We want to talk about all the changes that can happen, the tubes and the anatomy and the things that can change and what are normal things and what are not normal things. So we really want them to know their body and all the anatomy and all the things. Some women like to have sex during pregnancy because the orgasms are amazing and some women don't. It's too sensitive. So you just need to talk about all the variations and changes that can occur and then really keep an eye on them. Some people get pelvic floor dysfunction, they get incontinence, they get separation of the symphysis pubis, they get back pain, they get rib pain, they get the pressure in their hands and their feet and the carpal tunnel and the tingly sensations. They can get morning sickness, they can get swelling, they can get preeclampsia, they can get backache, they can gain too much weight, they can gain too little weight, they can have relapses of mental conditions, and maybe they stop smoking when they're pregnant but then they have a relapse postpartum, and there's so many possible things. Maybe they have a history of suicidal ideation and didn't want to get pregnant and now they're having they don't want this baby inside their body, and so you're going to have a lot of mental and physical changes occur, and our job as a midwife is to help them navigate the more common ones and the ones that are concerning that we need to follow up with. So this is the intent of this section, is just to give you a high level overview of all the things that happen in a woman's body when she becomes pregnant. Nothing deep down the rabbit hole of situations and pathophysiology. I want this just to be a high level step of there's so many changes, and so every woman is different and every situation is different, and so our job as midwives is to know these are variations of normal versus this is really serious, and maybe it will self-resolve, maybe we should do extra testing, maybe we should have her come back a little sooner, but our job as the midwife and care provider is to support them through the normal changes, educate them, watch for signs and symptoms of underlying things that could be complications versus this is a normal variation of pregnancy.